are saying different things.
After hours of deliberation following the outbreak that continues to leave thousands infected and over 100 others dead, the World Health Organization has now declared coronavirus a public health emergency of international concern. The decision on Thursday was informed by an increase in the number of cases reported in China, the epicenter of the outbreak, and a rise in the number of infections in other countries.
There are now 7,834 confirmed cases, including 7,736 in China, representing almost 99% of all reported cases worldwide. 170 people have lost their lives to this outbreak, all of them in China.
To help us understand what this declaration means for Kenya, we spoke to the WHO representative to the country, Dr. Rudi Eggers, who confirmed that a suspected case at the Kenyatta National Hospital tested negative for the virus.
There are requirements in terms of reporting, so that now that it is declared a global health emergency, if there are cases in Kenya, Kenya is required to report them. Also on their activities that they have to actually do the surveillance, screen for patients, to isolate patients and to treat the patients.
Dr. Eggers says the UN Health Organization will now be able to assist countries which are not prepared to deal with the virus, given concerns of its potential spread to countries with weak health systems.
By virtue of it being made a public health emergency of international concern, it means that WHO can release staff, can release resources. Is Kenya doing enough? It's difficult to say. I mean, we're really in the first part of the outbreak. I think it is learning very quickly, like all countries are. In terms of the suspected case that came in, I think the procedures were followed correctly. So all of the procedures, I think, that were put in place that are reasonable were in place, and actually I think the case was found, was isolated, was handled properly at the airport, was put in isolation. That's exactly where you want a suspected case to be.
Currently, only 10 laboratories in the entire globe have the capacity to test for the virus, whose incubation period is between 2 to 10 days. In Africa, only one lab based in South Africa has such capacity.
It is planned, however, that there are many other labs in the continent that are of good capacity. For instance, Kenyatta laboratory. Once we are able to share out the reagents and the material that you need for the laboratory and have trained the lab technicians, it should be possible that these kind of tests are done in other laboratories, including Kenyatta.
This is not the first time that the WHO has declared a global health emergency. Other outbreaks that have attracted similar attention include Ebola, the Zika virus and the H1N1.
Clearly we have to be prepared, so we have to set systems in place that if there are suspected cases that we deal with it. But there's no reason to panic at this moment. I think that is a clear message.
Meanwhile, the national carrier Kenya Airways has temporarily suspended all flights to and from Guangzhou, China, following the outbreak. Gloria Milimu, K24 TV.